Effects of rheumatoid arthritis. Different parts of the body. People feel the primary symptoms of rheumatoid arthritis in their joints. However, this condition can also affect many other parts of the body, including the eyes, lungs, and heart. Rheumatoid arthritis causes a person's immune system to mistakenly attack healthy tissue. Left untreated, rheumatoid arthritis can have wide-ranging effects. Along with the joints, rheumatoid arthritis can affect many of the body's organs, including the heart, eyes, and brain, as well as the skeleton. Medication for rheumatoid arthritis can also cause side effects across the body. Which body parts are affected by rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease. Doctors also classify it as a systemic disease because of the extensive changes it can make to different body parts. The joints. Rheumatoid arthritis can affect any joint in the body, and it commonly develops in the fingers, hands, and feet. The condition can also affect joints in the necks and its vertebra, spine, knees, ankles, hips, shoulders. Rheumatoid arthritis primarily targets the lining of the joints called the synovium. The condition causes the synovium to become inflamed and swollen. When the lining of a joint swells, it can lead to stiffness, pain, and a loss of mobility. People often experience joint pain and stiffness in the mornings, and this can be one of the first signs of rheumatoid arthritis. The skeleton. The joints contain cartilage which prevents the bones from rubbing together. Over time, inflammation from rheumatoid arthritis can cause the cartilage to break down. If the bones rub against one another, it can permanently damage the joint. This is a significant cause of pain and stiffness in people with advanced rheumatoid arthritis. Rheumatoid arthritis can also cause the bones to lose density, becoming thinner and more brittle. This increases the risk of breaks and fractures. The skin. In as many as 20% of people with rheumatoid arthritis, rheumatoid nodules form near the joints. These are small, firm bumps made of inflammatory tissue. Rheumatoid nodules develop under the skin over bony areas. While they are often painless and are generally not a cause for concern, they can cause discomfort if a person places pressure on them, such as when kneeling. Rheumatoid arthritis can also cause inflammation in the skin, sometimes leading to red patches, swelling, ulcers, or lesions. When rheumatoid arthritis affects the skin, a person may notice symptoms ranging from harmless red dots to ulcers on the legs or under the nails. They may also notice that wounds heal more slowly than usual. Many factors can cause longer healing times in people with rheumatoid arthritis, including vasculitis or inflammation of the small blood vessels in the skin. Some rheumatoid arthritis medications can also cause skin rashes. The mouth. People with rheumatoid arthritis are more likely than others to experience dry mouth or xerostomia. Having rheumatoid arthritis increases a person's risk of developing Sjogren's syndrome, which causes dryness in the eyes and mouth. Like rheumatoid arthritis, Sjogren's syndrome is an inflammatory autoimmune disorder. Rheumatoid arthritis can also cause saliva ducts to narrow or close, leading to an uncomfortable feeling of dryness in the mouth and difficulty eating and swallowing. Chronic dry mouth can also contribute to gingivitis and tooth decay. The eyes. Rheumatoid arthritis can also cause inflammation in the eyes, as well as dry eye syndrome, which can lead to ongoing irritation and eventually damage the cornea. The effects of rheumatoid arthritis on the eyes can include keratitis sicca or dry eye syndrome, scleritis or inflammation of the whites of the eyes, uveitis or inflammation of the inner eye, retinal vascular occlusion or blocked blood vessels in the eye, glaucoma, which damages the optic nerve, cataracts, which results from inflammation in the optic lens. Lungs. In around 80% of people, rheumatoid arthritis affects the lungs. The effects are usually not severe enough to cause symptoms. However, prolonged inflammation in the lungs can lead to pulmonary fibrosis, which can cause scarring and breathing difficulties. Rheumatoid nodules can also form in the lungs, though these are not usually a cause for concern. Some rheumatoid arthritis medications can make the immune system less effective. This can make people more vulnerable to respiratory infections, including pneumonia and tuberculosis. The heart. Inflammation from rheumatoid arthritis can damage the heart and blood vessels. In some cases, the consequences are life-threatening. Rheumatoid arthritis can cause the following complications: anemia. Unchecked inflammation can lead to iron deficiency anemia. This refers to a low level of red blood cells, and it can cause headaches and fatigue. Atherosclerosis. Chronic inflammation can damage the walls of the blood vessels. This can cause the body to absorb more cholesterol, which can cause plaque to build up inside the arteries. The medical term for this is atherosclerosis. Heart attack or stroke. If plaque builds up and blocks an artery or another blood vessel, a heart attack or stroke can result. Pericarditis. Rheumatoid arthritis can cause inflammation in the lining of the heart or the pericardium, and this can lead to chest pain. The nerves. Rheumatoid arthritis causes inflammation and swelling, which can compress the nerves in the area. When this occurs, a person may notice numbness or tingling in the hands or feet. When rheumatoid arthritis develops in the wrist, it can lead to carpal tunnel syndrome. This occurs when inflamed tissue in the wrist squeezes a nerve that extends from the forearm. The feet. If rheumatoid arthritis affects the feet, it can limit a person's mobility. Because the feet bear the entire weight of the body, the pain from rheumatoid arthritis can become severe. The condition often develops in the joints of the toes and less commonly the ankles. The mind and brain. Many people with rheumatoid arthritis may experience psychological or neural symptoms, including brain fog, depression, cognitive issues, changes in behavior. These symptoms may arise as side effects of medication as a result of body-wide inflammation, when damage to the bones in the joints leads to a compression of nearby nerves. The kidneys and liver. Prescription medications for rheumatoid arthritis can cause complications, including liver and kidney damage. This can result from long-term use of painkillers or anti-inflammatory medications. Long-term effects of rheumatoid arthritis. Rheumatoid arthritis is a progressive disease. This means that if a person does not receive treatment, the symptoms usually get worse. Over time, a person may notice symptoms in other joints or parts of the body, or existing symptoms may grow more severe. Rheumatoid arthritis causes inflammation in one or more joints. This can cause the cartilage in the joints to wear away. As a result, the bones may rub together and eventually start to erode, causing permanent damage. Medications can slow the progression of the disorder. In more advanced cases, surgery or joint replacements can help. Rheumatoid arthritis can be unpredictable. In the long term, people with rheumatoid arthritis may notice changes in the severity and frequency of symptoms, periods in which symptoms flare up, which can become more or less frequent, periods of remission that vary in length. When rheumatoid arthritis progresses, a person experiences more frequent symptoms and pain often grows worse. Some common indications that rheumatoid arthritis is progressing: pain and swelling increasing, pain and swelling occurring more regularly, other symptoms arising more frequently and lasting for longer periods, symptoms appearing in new areas, blood tests recording high levels of rheumatoid factor. If a person notices new symptoms, or if symptoms worsen or appear more frequently, they should contact a doctor. People with progressive rheumatoid arthritis often benefit from a tailored treatment plan. The doctor will build this according to the person's symptoms and history. Treatment can also involve specialists in different areas.